Come in.
Hey, how are you doing today?
I'm good. How are you?
I'm doing great. Thank you for asking. My name's Adrian. I'll be your nurse today, okay?
Okay.
All right. Can you verify your name and date of birth for me?
Kate Valdivia, November 11, 2001.
All right, Miss Valdivia. Well, I checked the doctor's orders, and while you're staying here, we're going to be inserting the NG tube, okay?
Okay.
That's just basically a tube that's going to run from your nose to your stomach. We're going to be using it to give you some feedings and possibly some medications, okay?
Okay.
All right. Before we begin, do you have any questions about the procedure?
Is it gonna hurt?
It may be a little uncomfortable, but it shouldn't be painful. But if at any point you feel like you can't breathe or it's unbearable, just raise your left hand and we'll stop, okay?
Okay.
All right. Now, before we begin, do you have any allergies?
No.
All right. Now, do you have any other questions for me?
Not for now.
Okay. Well, if you're ready, I'll go step out, perform hand hygiene, and I'll gather my supplies, okay?
Okay.
All right.
Come in.
All right, Miss Valdivia, I've washed my hands, I've gathered my supplies, and I'm back. I'm just gonna be raising your bed to a good, safe working level, and I'm gonna also be raising the head of your bed to about a 45-degree angle, okay?
Okay. That's good.
All right. Good. Now, I'm gonna put some hand sanitizer on just to make sure my hands are clean. And then I'm gonna be checking a few things. I'm gonna be checking your nostrils and your mouth. Is that fine with you?
Yes.
Okay. Now, do you have a preference on which nostril you would like to use?
Probably my left one.
Okay, that's fine. I'll just be taking a quick look to make sure that's the best one for us to be using, okay?
Okay.
All right. Can you blow out of your left nostril? Good. Can you blow out of the right? Great. Now, can you open your mouth and say "I"? Okay. You have a bit of a strong gag reflex, so I think it'll be best for us to put a towel on your clothing, okay?
Okay.
That way, in case you gag or spit up or anything, you'll have something to protect your clothing. And then also, I'm gonna give you this basin. That way, if you do spit up, you can spit up directly into that basin, okay?
Okay, thank you.
No problem. I'm gonna also be giving you this cup of water, and that's just to help the tubing go down whenever you swallow it, okay? But I will instruct you as to when to do that.
Okay.
All right. I'm gonna go ahead and cut a few pieces of tape so that I'll have them ready. Good. And then I'm gonna go ahead and clean your nose, and that's just gonna help the tape stick better whenever it's there, okay?
Okay.
All right. All right, Miss Valdivia, do you have any other questions before we begin?
Nope.
Okay. Well, I'll just go ahead and get my tubing ready. We're gonna measure, and then we'll be ready to insert, okay?
Okay.
All right, Miss Valdivia, the first thing I'm gonna do is put this at the tip of your nose, and we're gonna measure it to the tip of your earlobe, okay?
Okay.
All right. That's at about a 15. The next thing I'm gonna do is measure from the earlobe to my xiphoid process. I'm gonna keep it at my 15 that I had, and we're gonna move down. All right. That's at a 55, so I'm gonna go ahead and mark that with my marker. And I'm gonna go ahead and put a little piece of tape right there just so I can be extra safe. Okay?
Okay.
Now I will be using this to stick it to your nose just for a temporary fixation, okay?
Okay.
All right. Well, if you're ready, I'm gonna go ahead and open up this loop. And we'll begin.
Okay, I'm ready.
All right, Miss Valdivia. Per our policy, I'm gonna have you tilt your head back, and then once you feel it at the back of your throat, just give me a mm-hmm, and then I'll start coiling it, and that'll help it move down. And then to help us bring that tubing down your throat, we're gonna bring the head to the chest, and you'll start swallowing the water, okay?
Okay, got
All
it.
right. If you're ready to begin, we can go.
Ready.
All right.
Mm-hmm.
All right, good. Bring your head to the chest and start swallowing that water for me.
Go. Go.
You're doing great. Just a bit more to go.
Cool.
There we go. You did good, Miss Valdivia. I'm just going to kink this tubing. We're going to be aspirating a little bit of contents, okay? Sorry. Good. All right, and now I'm going to test that pH with a pH strip. Okay, and then we're going to compare it. You're at a 4, so that's good. That's kind of what I was looking for. That's within range, okay? I'm going to go ahead, stop up your tubing, and we're going to permanently secure it. The tubing got a little bit coiled there, didn't it? That comfortable for you, Miss Valdivia?
Mm-hmm.
Okay, and then lastly, I'm gonna be putting this one right here to secure it to your gown, okay?
Okay.
All right, you did really good. Now, I'm just gonna perform hand hygiene and we'll do some mouth care, okay?
Okay.
Some mouthwash. All right, are you ready? We're gonna clean your teeth, your gums, your cheeks, and your tongue, okay? All right, you can spit up into this basin. Great,
Thank you.
no problem. And then I'll just clean this up, okay? And I'm gonna put your bed to the lowest level, okay?
Thank you.
No problem. Would you like me to set your head back in?
Sure.
All right.
That's good.
Okay. Well, Miss Valdivia, if you don't need anything else and you have your call out, then I'll just be gone, okay?
Okay. Thank you.
No problem.